So there are a number of reasons why somebody may experience constant nasal congestion. Broadly speaking, these may be divided into structural reasons and medical reasons. So structural reasons can include things like a deviated septum. So the septum is the middle partition of your nose that divides your right and left nostril, and it is made of bone and cartilage. If it is deviated in any shape and form, it can reduce airflow when you attempt to draw breath through your nose, and that can result in symptoms of nasal congestion. The second reason is due to medical conditions. So if you have a predisposition to allergies or sinus inflammation, that can increase the inflammation of the lining of the nose or the mucosal surfaces, and this can in turn result in symptoms of nasal congestion. So you can tell if your nasal obstruction is due to a deviated septum or nasal allergies by some of the other symptoms that you may experience when you experience allergies. For example, if you have constant sneezing or itching of the eyes or watering of the eyes when you are exposed to certain triggers like dust or pollen, you may be able to conclude that your nasal congestion is due to allergies. However, in the absence of these symptoms, if you still experience difficulty with symptoms of nasal obstruction or nasal congestion, it may be due to a deviated septum. And in most patients, you might even be able to feel or identify visually that the middle partition of your nose is slightly drifted or blocking off one nasal passage versus the other. You should consider seeing an ENT specialist for chronic nasal blockage if this is impacting your quality of life. For example, if it is interfering with your day-to-day activities in terms of exercise or even disrupting the quality of your sleep at night, which could result in symptoms of snoring due to mouth breathing, then seeking out specialist advice and help is something that you should consider. So the most effective treatments for long-term nasal congestion would really depend on the cause of the nasal congestion in the first instance. If the cause of the nasal congestion is medical, for example, if it is due to allergic triggers or inflammation of the lining of the nose, then intranasal steroid sprays and saline rinses in the form of medical treatment may be a suitable option. However, if the cause of the nasal congestion is structural or due to your anatomy, then it is a physical problem and requires a physical solution. And for consideration of procedures like a septoplasty, which is a form of surgery to correct a deviated septum, to align and straighten the anatomy of your nose, to allow for improved airflow, is something that may be advised by your ENT specialist consultant. That is a very good question. So nasal obstruction can indeed affect sleep quality, as nasal breathing is very important to optimize the stability of airflow through the nose and into the airways. If the nose is blocked for various reasons due to structural obstruction or inflammation or congestion of the lining of the nose, a lot of my patients tend to revert to mouth breathing. And when you breathe through your mouth, the column of air is more turbulent, which can result in higher likelihood of symptoms of snoring. Now, if you think about snoring and sleep apnea like a jigsaw puzzle, there are a number of pieces that can contribute to snoring and sleep apnea symptoms, of which nasal obstruction and nasal congestion is one of those pieces. It is not frequently the prime source or the primary source of obstruction. However, it fits into the overall picture of exacerbating the symptoms of snoring and obstructive sleep apnea. Hence, it is something important to be evaluated and addressed if present.